Hey guys, it's Dr. Hansen with Hansen Health Solutions. So February is National Heart Health Month, and most people unfortunately have a very poor idea of their risk for heart disease. Really, this is, I would say, something that we need to take responsibility for as a profession in healthcare, because we've really done a bad job of educating, the public on what your risks are for heart disease, how you can monitor those, and how to make an actual difference in it. Most people, unfortunately, at this point, look at heart disease risk in pretty much one area, just their cholesterol, and they subdivide that into their HDL and their LDL. And they think HDL is the good stuff, LDL is the bad stuff, and that's pretty much the extent of it. Again, unfortunately, as practitioners, we tend to reinforce that idea. And while this seemed to be correct or seemed to be a good idea a long time ago, we've since come to realize for a long time now that this is just, unfortunately, absolutely wrong. HDL and LDL by themselves don't really give us any clear idea as far as how much you are at risk for heart disease, whether things are in good shape or bad shape, etc. And unfortunately, just pretty useless as far as all that goes. So what do we do? Well, just as a brief explanation, HDL and LDL, that last L right there, L stands for lipoprotein. And the HDL is just high density lipoprotein, the LDL is low density lipoprotein. So this is kind of what we would call lipidology. And what most people don't understand is that LDL, for example, has various subsets. There's lots of different little types of LDL. There's also, of those different types, you have different sizes. So you could have different, I'll write these up here for you. Particles and sizes. We'll take this off of there. So there's lots of different subcategories of these different lipoproteins, and when we look at the particles and the sizes, that's actually where we really get an understanding of what you're at risk for. So you could have a very high LDL number, but if those are certain particles and certain sizes, you actually still have a very low risk of heart disease. But if you have certain particles, a lot of certain particles and a lot of a certain size of those lipoproteins, then we know with an absolute surety, without a shadow of doubt, what all the research shows us right now is your risk for cardiovascular disease goes through the roof. So again, very unfortunately, very tricky to just try and base things off of HDL and LDL by themselves. But when we dig into this a little bit more, the research is actually very clear on our risk for heart disease. And this is something that most people just have no clue about. So this is something that we check here at Hansen Health Solutions. We do these cardiovascular panels on everyone to get a real understanding of what their cardiovascular risk is and how we can help them and actually mitigate their, risk for heart disease. This is something that's one of the leading killers in the United States, so something that everybody needs to be concerned with, especially if you have a lot of family members and people around you that are already struggling with this, from hypertension to high blood pressure to history of strokes or heart disease, etc. So there's a few other things that play into our risk, and that's going to be stuff like inflammation and other lifestyle choices that will take a bad situation and make it worse. And so, again, this is all stuff that we check here at Hansen Health Solutions. I just wanted to give you guys, again, the heads up there. So February being National Heart Health Month, if this is something you're concerned with and that you're looking to make changes in, come see us and we can run a real panel to see exactly what your risk is and help you make changes if necessary. Hopefully that's been helpful to you guys. Again, the main point here, HDL and LDL are not enough. This is not useful data. Based off current understanding and research. We need to dig into that a bit more, and that's how we keep you from getting heart disease.